Okay, thank you, Elizabeth. So next we will turn to Dr. Ryan Watson. He'll be talking about the importance of GSAs for reducing victimization in British Columbia schools. This one, right?
All right, thank you all for being here. It's really exciting to have a group of people who are invested in men's health to talk about research with. And so as a postdoc at UBC, I'm involved in a few projects. I'm going to present some data from one of them. Another one, I realized I'm in the context or in the presence of the stakeholders of knowledge of a project that I've piloted at UBC, and that's a project that investigates hooking up amongst young adults in Vancouver. And so if anyone wants to talk about their hookup experiences, I'm your guy to talk to. If you want to share that and share that, there's no studies out there that focus on hooking up amongst sexual minorities anywhere in North America or in the world, really. And so that's kind of another exciting thing that we're learning about young adults here in Vancouver. And this is another aspect of what we're doing in the center at UBC as a way to understand protective factors, structural level protective factors for sexual minorities. And so today I'm going to talk about how can we undo stigma through a school level intervention, prevention, which is gay-straight alliances, and how this impacts school environments for lesbian, gay, bisexual, transgender, queer youth. And so I think we all know anecdotally at least, or some of us that have been in school recently know that GSAs are very important for impacting school climate, for helping youth feel safer, impacting mental health and all kinds of different psychosocial outcomes for sexual minorities. Over the last 10 years, 20 years maybe, research has slowly explored the importance of GSAs and looked at cross-sectional data to understand what the importance are for school-level safety or mental health factors at schools. And so we know that the GSAs themselves, the presence of them are related to well-being for adolescents and in high schools and middle schools as well. We also have emerging evidence that shows that GSAs can mitigate and buffer the negative impacts of stigma, gay bias, some scholars will call it, buffer the impact of that against negative mental health, so depression or feelings of unsafe or feelings of non-belonging at school. And so we know that GSAs, for those of you that may not know, are created to promote safer environments, to educate all students about issues facing LGBTQ youth at schools. But emerging evidence also shows that not only are these clubs forming a safer school environment for sexual minority youth, but also heterosexuals report feeling safer at school, feeling more mentally well, reporting less suicidality at school. And so it's really holistically a very great program for students across North America and some emerging evidence here in Canada. So in this study, we look at multiple waves of provincial data here in BC. And this is different from previous research because most scholars have to rely on cross-sectional data with data points just at one time. And here, it's not longitudinal in the sense that we follow youth over time, but we've sampled the same schools over the span of 15 years to understand what are the relative impacts of GSAs. And here we're not just asking, does your school have a GSA or not? We've been able to look at the length, the duration of GSAs and that impact on a multitude of outcomes. Here I'm going to focus on some school experiences such as victimization. And so 3 things I'm going to present to you today. One are trends in school outcomes, specifically teasing and harassment based on sexual orientation. Also disparities, so you'll see the trends and how they're increasing or decreasing over time, but are those differences between the schools that have GSAs or don't, are those statistically significant? Are they actually meaningful, or maybe are they due to noise? And I'm going to look at some of the gaps, a kind of novel, neat statistical method where we can actually compare gaps in trends and whether they're narrowing or widening over time. And so that's kind of what we're trying to do in the study. We used the British Columbia Adolescent Health Survey, which is very similar to AdHealth, which Mark talked about in his keynote, a data set that looks at a multitude of health indicators, so bullying, parent support, teacher support, academic achievement, a host of experiences at school for heterosexual and sexual minority youth. The McCreary Society Center, a nonprofit here in BC, just up the street on Hastings, they have created and carried out this survey every 5 years since 1992. And we typically have about 25,000 youth participate every year. So really, really great, interesting data that we've been able to apply to the sexual minority youth population from a representative kind of frame. Yeah. So in this study, we're looking at 3 waves. We aggregated 2003, 2008, and 2013 data to look at trends in these outcomes. Like I said, the McCreary Society Centers worked with StatsCan to weight and appropriately sample different schools in BC to ensure that we can generalize our findings to all youth in BC. Another limitation, as you probably all know, of cross-sectional and local studies of LGBT youth are that kids in New York don't necessarily have the same experiences as kids in Kansas or in I'm not sure the equivalent of Kansas in Canada, but wherever it may be, Calgary, I don't know, or somewhere in the prairies. So at least in BC, we're able to say this is a pretty representative experience of what we might see of youth around the province. And like I said, we have heterosexual and sexual minority identified youth in Canada, and in this study, we're just going to focus on what are the impacts of GSAs for sexual minorities. And the measure we use is as a question that asks youth, how do you identify completely heterosexual, mostly heterosexual, bisexual, mostly homosexual, or homosexual. Something interesting to note, other data have treated the mostly heterosexual category separately, and there's a whole literature and discussion about that. But in this study, we're just looking at bisexual and gay men for today's data. Something novel that we added to this data set, kind of like Mark's work in aggregating other large data sets, is we called each school that participated in the BC Adolescent Health Survey and asked them whether or not they had a GSA and whether or not they had school policies that were enumerated or not enumerated for anti-bullying policies for LGBT youth to protect against harassment. And so here I'm reporting what we found about the GSAs. And we asked what year, if you have a GSA, there were about 124 schools that reported they had a GSA. We asked what year it started. And so to be able to cohesively, manageably present these results to you, we've grouped them into 4 different groups. So schools that don't have GSAs, there's 134 of those in BC. Schools that have had GSAs the longest amount of time. So they established a GSA between 1998 and 2003. And so for ease of explanation, I'll say that those are schools that have a GSA established between 12 and 17 years ago, the longest time ago. The next group is between 2004 and 2008, so they established a GSA between 7 and 11 years, and the other group is between 2009 and 2012. We excluded GSAs, or schools that initiated GSAs in 2013 because our data collection was 2013, and we didn't expect that getting a GSA 2 months before data collection would really make a meaningful impact on school safety, perhaps, but not measurable. And so we have GSAs up to 2012. Also important to note, many more schools after 2013 in BC have adopted GSAs because of the work of CRBC and scholars that do this kind of stuff in BC. So those aren't included in these analyses. Today, I'm going to talk about teasing and harassment. These are the measures how we asked about it. We also look at more multidimensional, complex scales of school safety, school belonging, school connectedness, where we're kind of getting at multiple dimensions of these constructs. But here I'm just reporting some dichotomous measures of teasing and harassment for simplicity's sake, for sake of simplicity. So results. For teasing, this graph is showing the 4 different groups of schools. So first of all, we look at student level reports, and we aggregated them to assign a school a mean score of how safe or how much teasing is going on in that school. So you could see the trends in teasing over time. The green line represents those schools in 1998 or 2003, 08, and 13 that don't have a GSA. And you can see that over time, these schools have the highest rates of teasing. And then the blue line represents schools that have that have had GSAs the longest. And so clearly the trend of teasing has been the lowest, and has the trends in teasing have been the lowest for those schools. Interesting to note here, you can see that by 2013, the schools that have GSAs, there's not so much variance or disparate reports in those schools of teasing. And so we talk about implications of why that may be at the end or after. Also, it's important to note here that if you see the white line, actually the first data point in 2003, there's higher reports of schools that don't have GSAs, but these schools actually didn't have GSAs at that time, because here they're grouped, we group them today based on whether or not they had GSAs by their corresponding groups. And so the white line are schools that had GSAs for the last 7 to 11 years, so in 2003, those schools actually wouldn't have had GSAs. But I'm arguing, and we think that perhaps that school had a climate or some kind of environment that was leading it to establish a GSA later on. And so you can that's a caveat to what you're seeing here. The next outcome is harassment for gay and bisexual males. And very similar patterns you can see here. The green line, no GSAs, the highest rates of harassment in schools that don't have GSAs, and the best experiences that are the least reports of harassment based on sexual orientation in those schools that have the longest reported GSAs. So kind of showing us the importance of length of GSA, which scholars haven't per se gotten to as much by this point in the field of research. So this is just looking at trends, not age adjusted at all. So you can imagine also, of course, we know that the 18-year-old in high school is having a very different experience than the 14-year-old. So our next step was to say, are these actually significantly different? So we use logistic regression to say, are there disparities between different groups in schools? In 2008, we adjusted for age in our models and found that GSAs that had, or schools that had GSAs for the longest amount of time, between 12 and 17 years, the students in those schools compared to schools that had no GSAs were 4 times less likely to report teasing than their counterparts. Similarly, the schools that had GSAs in the middle adoptant range, 7 to 11 years, in comparison to their schools with no GSAs, were 2 times less likely to discriminate based on sexual orientation. And this kind of novel, neat statistical method that I talked about, which is looking at ratios of ratios, so comparing odds ratios, we found widening gaps. So to simplify it, if we see the gaps in teasing are going down over time for heterosexuals, for sexual minorities in schools that don't have GSAs, and we see that the trends in teasing are also going down, but at a different rate, or not as steadily going down for schools and for students in other schools, is that actual gap, is it widening or is it narrowing? So what we found was that these gaps and disparities are actually widening over time, showing that schools that don't have GSAs are becoming progressively, that they're not, over time, they're not benefiting from, the students aren't actually reporting less teasing over time. It's actually getting worse off, if that wasn't very clear, but if that makes sense. So what does this mean? To me, what are the conclusions? Victimization is significantly different depending on GSA. We see some significant odds ratios, some significant disparities over time. It's implying that the longer you have the GSA, the safer school environments that we're seeing. I think this shows we're beginning to understand the role of GSAs over time. One thing Mark did in his presentation was talk about alternative explanations. And here it's hard to do that because I'm not measuring stigma, or we're not taking into consideration policies or gay marriage being passed in 2003, or these other kind of things that are going on. And so this is kind of independent of that. Our next, another project we're working on is looking at latent growth curve models, or longitudinal kind of explorations into, well, above and beyond gay marriage being passed, or whatever it may be, what is the unique variation of these outcomes being explained by GSAs by adjusting and teasing out these different factors that we know lead to safer schools and whatnot. So an important next step, I think, that we can take. I think that it shows us GSAs are important school-level interventions. We talk a lot about what we can do at the interpersonal level. I study family a lot, all very important things. But what can we do at a more structural, school level? How can we promote these kind of preventions or interventions that clearly make big differences in schools? And so we can continue promoting safer and better school environments for youth. A couple limitations, probably more than just a couple, but I'll point out two. This is only generalizable to youth and schools. We have a lot of work to do on other disadvantaged youth who are homeless or who don't attend schools or who have dropped out for other reasons. And so we should continue to try to collect data or explore data that is not just school-based and consider those populations. We also, like I said, collected data on school policies. And so we're not here considering a possible synergistic effect. What about schools that also have an enumerated anti-bullying policy, or schools that don't, or schools that have both or either? That's something that isn't being assessed, but I'm sure very, very important in this exploration of GSAs. So that's about it. Thank you so much for being here. Thanks to all the funders and everything else.